Good morning, everyone, and thank you for being here today. I'm Dr. Asim Hussein, and I'm pleased to welcome you to this presentation on high-altitude illness. Today, we'll explore the key aspects of this important topic, including its causes, symptoms, and management strategies. Over the next few minutes, I hope to provide you with valuable insights that can help in understanding and addressing high-altitude health issues. Let's get started. Let's look at this scenario. A 34-year-old man ascends rapidly to 3,800 meters, and within just 12 hours, he's experiencing a headache, nausea, dizziness, and poor sleep. Interestingly, his neurological exam is still normal at this point. Now, these symptoms are quite telling. They suggest he's experiencing some form of altitude-related illness. The key here is the rapid ascent and the early symptoms, headache, nausea, and dizziness, without any neurological deficits. This pattern is characteristic of acute mountain sickness. It's important to recognize that symptoms typically develop within the first few hours to a day of reaching high altitude. Now, comparing this to other conditions, like high-altitude cerebral edema or pulmonary edema, those tend to occur later or with more severe symptoms. And heat exhaustion or hypoglycemia are different issues altogether, more related to heat exposure or blood sugar levels. So, given this presentation, the most likely diagnosis is acute mountain sickness, or AMS, which is quite common when ascending quickly to high elevations without proper acclimatization. Recognizing these early signs helps us intervene before more serious conditions develop. Correct answer. See now, let's go over why that's the right choice. Acute mountain sickness, or AMS, typically presents with a combination of symptoms that include headache and systemic signs. These systemic symptoms can involve gastrointestinal upset, like nausea or vomiting, dizziness, and feelings of fatigue. Importantly, these symptoms usually occur within 6 to 24 hours after ascent to a high altitude. One key point to remember is that, unlike other conditions, AMS does not involve focal neurological signs or neurological deficits. So, when evaluating a patient with recent high-altitude exposure, keep in mind that if they have headache plus systemic symptoms developing within that timeframe, and no focal neurological findings, AMS is the most likely diagnosis. Recognizing these features early is crucial for proper management and avoiding progression to more severe altitude illnesses. All right, let's look at this case carefully. We have a 41-year-old trekker who has ascended to 4,500 meters. Now, at high altitudes like this, the body faces significant challenges due to lower oxygen levels. The symptoms he's experiencing are severe headache, confusion, ataxia, and altered consciousness. These are quite serious signs. Now, considering the options, the most likely diagnosis here is high-altitude cerebral edema, or HACE. This condition is a severe form of high-altitude sickness where brain swelling occurs due to hypoxia. It's characterized by neurological symptoms such as confusion, loss of coordination, and even coma in advanced stages. It's important to recognize that these symptoms are different from other conditions like stroke or alcohol intoxication, which can sometimes mimic similar signs but have different underlying causes. So, in summary, the key points are that at high altitude, neurological symptoms like these point towards high-altitude cerebral edema, and prompt recognition is crucial for treatment and safety. The correct answer here is D now. Let's go over why. HACE stands for AMS, which is altered mental status, plus neurological signs such as ataxia, confusion, or even coma. These symptoms indicate a serious condition that can be life-threatening. It's crucial to recognize that HACE requires immediate treatment to prevent further deterioration. Remember, these signs aren't just minor issues. They point to a potentially critical situation that demands urgent medical attention. This ties into our overall theme of timely diagnosis and intervention in neurological emergencies. All right, let's take a closer look at this interesting case. We have a 29-year-old climber who has reached an altitude of 4,200 meters. Notice he's developing dyspnea at rest. That's shortness of breath even without exertion, which can be quite alarming. He's also coughing up pink, frothy sputum, which is a classic sign we should pay attention to. Additionally, he's experiencing tachycardia, meaning his heart is beating faster than normal, and hypoxia, indicating low oxygen levels in his blood. On chest exam, we hear bilateral crackles, which suggest fluid accumulation in the lungs. All these signs, shortness of breath, pink frothy sputum, tachycardia, hypoxia, and crackles, point towards pulmonary edema. Now, considering the context of high altitude, this is characteristic of high-altitude pulmonary edema, or HAPE. HAPE is a form of non-cardiogenic pulmonary edema that occurs in susceptible individuals when they ascend rapidly to high elevations. It results from increased pulmonary artery pressure, leading to fluid leaking into the alveoli. So, when we connect all these key features, it's clear that the most likely diagnosis here is D, high-altitude pulmonary edema. This case beautifully illustrates how altitude sickness can escalate and why early recognition and management are crucial. The correct answer here is D. Let's break down why. HAPE, or high-altitude pulmonary edema, typically presents with non-cardiogenic pulmonary edema, which means it's not caused by heart problems, but rather by fluid leaking into the lungs due to altitude-related factors. Patients often experience severe hypoxia, so their oxygen levels drop significantly, and this can happen quite quickly after rapid ascent. You might also notice frothy sputum, which is a hallmark sign, indicating fluid in the airways. It's important to recognize that HAPE usually occurs after a sudden or rapid ascent to high altitude, making this a key point in understanding its presentation. So, when considering the overall picture, remember that HAPE presents with these characteristic signs and symptoms, and the context of recent rapid ascent is crucial for diagnosis. All right, let's look at this case. A patient with HACE who is confused and hypoxic at altitude. Now, HACE, or high-altitude cerebral edema, is a severe and potentially life-threatening condition caused by rapid ascent or inadequate acclimatization. The key here is that the patient is showing neurological symptoms like confusion, along with low oxygen levels. When managing HACE, the most urgent priority is to reduce the brain edema and improve oxygen delivery to the brain. So, among the options, what should we focus on first? Option A suggests aggressive IV fluids, but that's more relevant for dehydration or hypovolemia, not the immediate crisis here. Option B is antibiotics, which are not indicated unless there's a suspicion of infection, but that's not the primary concern in HACE. Option C is immediate descent with supplemental oxygen. This is crucial because descending to lower altitude reduces the hypoxic stress, and giving oxygen helps improve oxygenation right away. Option D, acetazolamide alone, is useful for prophylaxis and mild symptoms, but isn't sufficient as the sole immediate treatment in severe cases. And option E, beta blockers, are not relevant in this context. So the most critical immediate step is to get the patient to a lower altitude as quickly as possible and provide supplemental oxygen. This combination addresses the root cause, hypoxia, and helps reduce cerebral edema rapidly. Therefore, the best answer here is C, immediate descent with supplemental oxygen. This step is essential to stabilize the patient and prevent further deterioration. It ties directly into our overall theme of recognizing and managing high-altitude illnesses swiftly and effectively. The correct answer here is C now. Let's talk about why. When it comes to treating high-altitude cerebral edema and high-altitude pulmonary edema, the most effective and life-saving intervention is immediate descent combined with oxygen therapy. This approach addresses the root cause by reducing the altitude and improving oxygen availability, which are critical steps in preventing further deterioration. Remember, rapid response is essential, and acting quickly with descent and supplemental oxygen can make all the difference in saving lives. This ties into our overall message about the importance of prompt recognition and intervention in high-altitude illnesses. All right, let's consider this scenario. We have a healthy 45-year-old planning a rapid ascent to 4,000 meters, and he has a previous history of acute mountain sickness. So, the key question here is, what's the most appropriate prophylactic measure for him? Looking at the options, dexamethasone is often used for severe cases or for those who can't tolerate other medications. Sildenafil is primarily used for pulmonary hypertension. Acetazolamide is a well-known, effective prophylactic agent for AMS because it helps with acclimatization by inducing a mild metabolic acidosis, which stimulates breathing. Loop diuretics are generally not recommended for AMS prevention because they can cause dehydration and electrolyte imbalance, potentially worsening symptoms. And oxygen only at night is not sufficient for prophylaxis, especially for someone planning rapid ascent. So, in this scenario, the most appropriate choice would be acetazolamide, as it's widely supported by evidence for preventing AMS in individuals ascending quickly to high altitude. This highlights the importance of pre-acclimatization strategies and pharmacologic prophylaxis in high-altitude travel, which ties back to the overall theme of safe ascent and altitude sickness prevention. The correct answer here is C now. Let's break down why. Acetazolamide works by enhancing the process of acclimatization, especially at high altitudes. It does this by inducing a mild metabolic acidosis, which is a subtle shift in the blood's pH balance. This change actually stimulates an increase in ventilation, helping the body adapt more quickly to lower oxygen levels. So, the key concept is that acetazolamide promotes better acclimatization by encouraging your respiratory system to work a bit harder, effectively boosting oxygen intake. This ties into our overall discussion of ways to improve adaptation to high-altitude environments. Let's take a closer look at the different conditions that can occur at high altitude. Starting with AMS, or acute mountain sickness, this typically presents with symptoms like headache and nausea, but you might also notice fatigue and poor sleep. It's often the earliest form of altitude illness and can be quite uncomfortable, but it's usually reversible with proper acclimatization. Moving on to HACE, or high-altitude cerebral edema, which is a more severe progression of AMS. In addition to the symptoms of AMS, you'll see ataxia, confusion, and in extreme cases, coma. This condition requires immediate attention because it can be life-threatening. Then there's HAPE, or high-altitude pulmonary edema. This manifests primarily with respiratory symptoms such as difficulty breathing, hypoxia, and sometimes frothy sputum. On auscultation, you might hear crackles in the lungs, indicating fluid buildup. All these conditions exist on a spectrum of high-altitude illness, meaning they can develop gradually or escalate quickly if not managed properly. Recognizing these key features early is crucial to prevent severe outcomes. Understanding this spectrum helps us better prepare and respond to altitude-related health issues. Let's take a closer look at the pathophysiology behind high-altitude illness. When someone ascends rapidly to high altitudes, the lower oxygen levels, or hypobaric hypoxia, trigger several physiological responses. For example, in the brain, this hypoxia causes cerebral vasodilation, which is the widening of blood vessels. While this might seem helpful, it can actually lead to fluid leakage and swelling, resulting in high-altitude cerebral edema, or HACE. On the other hand, in the lungs, hypoxia causes pulmonary vasoconstriction, which is the narrowing of the blood vessels. This response helps redirect blood flow, but it can also increase pressure in the capillaries, leading to capillary leak and the development of high-altitude pulmonary edema, or HAPE. Understanding these mechanisms is key because they explain the different manifestations of high-altitude illness and highlight how the body's responses to hypoxia, although initially adaptive, can sometimes become harmful if exposure continues or progresses. This is a critical aspect of the overall picture of high-altitude physiology and why careful acclimatization is so important. Now, let's talk about some of the risk factors that can increase the likelihood of high-altitude illness. One of the most important is a rapid ascent. The faster you go up, the less time your body has to acclimate to the decreasing oxygen levels. Climbing quickly above 2,500 meters significantly raises the risk. Another key factor is having a history of prior altitude illness. If you've experienced symptoms before, you're more likely to encounter them again, so it's crucial to take precautions. Excess exertion also plays a role. Pushing yourself too hard can stress your body and make symptoms worse or trigger illness. Additionally, alcohol and sedatives can impair your body's ability to respond to altitude changes, so it's best to avoid these substances during ascent. All these factors, rapid ascent, previous altitude issues, exertion, and substance use, are interconnected and can elevate the risk of developing high-altitude illness. Being aware of these helps us plan safer ascents and prioritize gradual acclimatization to reduce complications. Alright, when managing high-altitude illnesses, the first and most crucial step is to facilitate descent, ideally a definitive descent if possible. This helps to reduce altitude stress and prevent worsening symptoms. Supplemental oxygen is also vital, as it helps to increase oxygen availability to the body and alleviate hypoxia. In cases of high-altitude cerebral edema, or HACE, administering dexamethasone can be life-saving by reducing brain swelling. For high-altitude pulmonary edema, or HAPE, nifedipine is commonly used to lower pulmonary hypertension and improve symptoms. If descent isn't immediately possible, using a portable hyperbaric chamber can serve as a temporary measure, simulating descent by increasing the pressure around the patient and improving oxygenation. Remember, the key to managing high-altitude illnesses is prompt recognition and rapid intervention to prevent severe complications. All these measures are interconnected in ensuring patient safety and effective treatment in the high-altitude environment. Let's talk about prevention strategies to help you acclimate safely to high altitudes. First, a gradual ascent is key. Slowly climbing allows your body time to adjust to the decreasing oxygen levels. Second, consider using acetazolamide prophylaxis, which can help prevent altitude sickness by promoting acclimatization. It's always best to discuss this with your healthcare provider beforehand. Third, avoid alcohol and sedatives during your ascent, as they can depress your respiratory drive and worsen symptoms. Fourth, incorporating rest days into your itinerary gives your body additional time to adapt. Remember, high-altitude illness can be serious, so these preventative measures are essential parts of your overall safety plan. By following these steps, you can reduce your risk and enjoy your adventure more comfortably. Alright, let's go over some important ICU pearls related to high-altitude illnesses. First, remember that in cases of high-altitude cerebral edema, or HACE, ataxia is a key diagnostic feature. If a patient presents with ataxia, that should immediately raise suspicion for HACE. Moving on to high-altitude pulmonary edema, or HAPE, a critical point is that these patients often have a normal heart exam despite severe hypoxia. So, severe low oxygen levels with a normal heart, think HAPE. When it comes to management, descent is the most crucial intervention, and drugs can be helpful, but they are adjuncts to rapid descent. Speaking of medications, acetazolamide is often used for altitude sickness prevention, but it's important to note that it is not a treatment for established HACE. Once HACE has set in, descent and supportive care are the priorities. Finally, always keep altitude illness in mind when you encounter unexplained hypoxia, especially if the patient has recently been at high altitude. These points are vital because recognizing them early can make all the difference in patient outcomes. Thank you so much for your time and attention today. I truly appreciate your engagement and interest in the topics we've covered. Remember, the key points we've discussed are all about understanding the importance of strategic planning, embracing innovation, and fostering collaboration to achieve our goals. I hope this presentation has given you some valuable insights that you can take away and apply in your own work. Once again, thank you for being such a great audience and for your commitment to continuous improvement. I look forward to seeing how you all implement these ideas moving forward.